In spinal muscular atrophy, time is motor neurons, and to save days, it's saving motor neurons. So newborn screening is extremely important, and all data go the same direction to show that pre-symptomatic patients have nothing to do with post-symptomatic patients. That's the data from SPRINT in the US, from Nurture for nusinersen, and it will be the data for rainbow fish. So we have to treat our patients before the symptoms. But even if we treat them before the symptoms, we have to treat them early and as early as we can. We have seen with the data from Nurture that patients with 2 copies have a very high level of phosphorylated neurofilaments, and that it means that every day they are destroying motor neurons. So saving days is extremely important. So in Belgium, we screen now for spinal muscular atrophy for 18 months, and we try to save days in the process. So by different actions led at the genetic department level, we try to save a maximum of days in the process. And by implementing this different action, we demonstrated that we could save day in the turnaround time, the median turnaround time, but also, which is very important in newborn screening, the 90 and 99 centiles of the turnaround time, which means the slowest sample rate. So if, for instance, 1% of your data take 20 days, it means that if by a matter of bad chance one patient is in this 1% of data, then these patients will have to wait too long to get its results. So it's very important for any programs to think about how to make it as fast as we can.
I think that also is quite important to the education for pediatricians and neurologists, because trying to detect the patients with spinal muscular atrophy as soon as possible is very important. Now it is like a urgent condition, because we know that if we have the diagnosis very early, we'll treat as soon as possible, and the response to treatment will be different. So it's quite important that pediatrician and child neurologists are aware of this condition. They are educated in how to detect the condition as soon as possible, just with, a hypotonic baby or tongue fibrillations or whatever. Try to think about SMA, even if it is not sure. Trying to order the genetic test is important, because we have a treatment now. SMA2 or SMA3, they are classified according to clinical results. It is connected with the genetic results, because the number of copies of SMN2 tend to have an association with the clinical results, but it's not exactly like this. So it's important to have the clinical condition and the motor milestones that they have acquired.
So the number of SMN2 copies, it's important. It is routinely done. I think now more and more in France anyway. And why? Because it guides you first to know more about the progression of the evolution of the disease. We know that the less copy of SMN2 you have, the more severe the clinical presentation is. And this could tell us also maybe about the chances of improvement with a new therapy that the patient could benefit from.